community-acquired pneumonia. For this brief discussion, I wanted to touch on nurse visits and how to properly bill for those. These would be your 99211 visits, and there just are a few rules that you have to follow in order to meet the criteria for a properly coded 99211 visit. First being that it has to be an established patient under your care as a provider or an advanced practice clinician. And whatever the patient is coming in for the nurse visit must be documented in the patient's plan of care. So some examples of acceptable 99211 nurse visits would be weight checks or blood pressure checks. Perhaps you have started on a new blood pressure regimen. The patient is under a weight loss program, and they are simply coming in to have an accurate blood pressure or weight check reading taken by either the RN, LPN, or medical assistant and then documented in their chart. These are acceptable. Another few examples would be the insertion of a urinary catheter. Patient simply comes in, perhaps has a catheter removed and replaced or a new catheter inserted. They are not assessed by the provider, but simply the device is inserted by the nurse and the patient leaves. Additionally, examples would be simple dressing changes as well as suture removals. As long as you, the provider, do not need to assess the wound and document on that, if the nurse is seeing the patient and doing that care and the patient is then leaving, these are all acceptable 99211 visits. And again, these must be separate from other services on that day. So say your patient comes in for a scheduled visit with you and subsequently has an additional blood pressure check, perhaps their blood pressure is elevated. This is not an acceptable 99211. That's just an extension of the care provided in that original visit with you. And some other examples of unacceptable 99211 visits would be things like injectable medications or vaccinations. And this is because these visits can be billed otherwise. So a vaccination or injectable medication, perhaps an injectable hormone, these, although they are just a nurse visit, they have a separate billing code that would not fall. It would negate the 99211 billing code, as well as lab draws, because it has its own billing code, venipuncture. And then telephone calls. 99211 still must be face-to-face, even if the face-to-face does not occur with the advanced practice clinician. The patient must be a face-to-face encounter with the MA, RN, or LPN. And also, as I stated, the 99211 visits must be an established patient. So this type of occurrence is never acceptable for a new patient to your service.